Thanks for joining us for this bonus COVID-19 and city news briefing for Tuesday, October 20th. We'll start with today's numbers. These are system-wide numbers for all of our healthcare organizations who are reporting their COVID statistics. As of this morning, 71,626 total tests, with 7,786 of those coming back positive, 63,294 negative, 487 tests currently pending. In the hospital today, we have 55 people between Mary Health Wesley and Forest General who are COVID positive. That's well over where we've been the last 2 weeks, with another 9 under investigation. And of those 55, 16 are in the ICU. You can kind of see here that we've had a pretty significant spike in hospitalizations. We'll talk about that in just a little while. However, luckily we're seeing ICU admissions stay flat, at least for now. Statewide, 730 new cases today with 31 new reported deaths. None of those deaths were in Forest or Lamar counties. Locally, Forest County saw an increase of 12 positive cases. Lamar County saw 22 new positives. We're hoping that we can get those back in the single digits soon. Totals to date for our entire metro area, just over 5,100 at 5,134. Our 5-day average number of positive tests, we average with the 2 days after and the 2 days prior. That dipped just a little bit, but we're still between 30 and 40 right now in terms of entire metro area of new cases per day. The inside 14-day number, this is the number of people who have received their positive test result within the last 2 weeks. In Forest County, that number is at 283, gives you an idea of how many active cases could be out there right now. So 283 in Forest County, Lamar County just behind at 266. We can see how this is the second day in a row that Forest County's total has dropped a little bit. Lamar County's kind of staying steady as well. We hope that's the sign of a downward trend. Week over week, compared to last Tuesday, there were 319 people that were potentially active cases. That's that inside 14-day number we talked about. That number's down to 283 today. Lamar County also saw a 5-person decrease from 271 to 266. So about a decrease of 40 a week ago. The problem is, even with that drop of inside 14 days, we've had a pretty significant shift upward in hospitalizations, going to 55 from 36 a week ago. ICU admissions are up just a slight touch as well. Our goals, these are the things we've talked about since March. Protecting the vulnerable. We know that people over the age of 60, people with underlying or chronic health conditions, tend to have a more adverse reaction to this illness. That's not always the case, but they're the more at-risk population. If we can keep them well, we can prevent overrun of the healthcare system by slowing the spread, because you won't have as many people coming into the hospital. And if we can do those two things, we can keep our economy open while still trying to prioritize public health. The bad news today that we really want to kind of just share with you, not to alarm you, but I think it's important to say, since last Friday, there has been a 20-plus increase in COVID-related hospitalization. That's a 61% increase in just 4 days. That is significant. Then we ask the question of kind of, where are these patients coming from? Are they local to us? Are they our own citizens who are getting sick and going into the hospital? Or are we collecting those from the surrounding communities who are coming here for the health care? Either way, you're putting the healthcare system at risk by having these folks here. But we kind of broke that down. Of those 55 patients, the largest share is in Lamar County at 14. Covington County and Forest County are tied for second with 6. And then you kind of see a sort of a smattering from other counties. And then you've got 14 other counties with 2 or less that are coming into Hattiesburg for the health care. You may be wondering, why is Forest County only have 6 people in the hospital, because they have such a higher inside 14-day number. Keep in mind, as we've talked about over the last 2 or 3 weeks, that the bulk of the Forest County new positive cases are happening on college campuses, and we're obviously seeing some in our secondary schools as well. And as we know, this illness tends to target and have more effect on the elderly, and so if you're younger, you have a better chance of not really having significant symptoms, and so you may see Forest County having more of an increase, but at the same time, you're seeing not as many hospitalizations because so many of those are younger people. In Lamar County, you don't have a university, but we know there's some school outbreaks there as well, but you're more likely, as those numbers go up, to catch more in the hospital. And so the bottom line is this: more positive cases will eventually turn into higher hospitalizations and ICU admissions and worse. This is important to us because we have to make a decision later this week and in the coming weeks on kind of what we're going to do with executive orders. We obviously know we're going to keep the mask mandate in place, But we want to keep the economy open. We want to let people find that functional normal, but it involves all of us being responsible and not overrunning our healthcare system. A couple of weeks ago, we talked about how both of our hospitals were already past their ICU limit, and both of them were kind of nearing capacity in acute beds, and that's a really bad thing going into flu season and cold weather. And so it's really incumbent upon each of us to do the right thing. And the city can set policy, the state can set policy to try and create an environment where people are behaving responsibly when they go out in public, but it's all about personal responsibility. And these are the three things we preach: wear a mask, practice social distancing, avoiding large crowds. Even if we have mask mandates, if people are getting together in homes, which we know people need to do, people need that socialization, but wearing the mask is a big part of that. And so would encourage you, while we still have a handle on this thing, to not let this thing spiral out of control like we did in July, and wear your mask, practice social distancing, avoid large crowds. If we can all just do that individually, we can turn that hospitalization number around. Hopefully that's just a 1 or 2 day thing and we start to see that number come down. Some city news. Tonight we will officially graduate recruit class 20-01 from the Hattiesburg Fire Department. The Hattiesburg Fire Academy is one of the toughest in the state, if not the toughest. And so these guys have been at it for a really long time, and so we congratulate them on finishing the academy, and they began shift work over the weekend. Speaking of which, if you would like, or someone you know would like to apply for Academy Class 21-01, you can visit hattiesburgms.com/jobs and apply there. That academy, those applications will be accepted through the end of November almost, and then Academy class will begin in February. And finally, our act of courage. This week is Make a Difference Week, and we are leaning on you individually by not having big events and businesses to go out and do their own service projects, and that happened today. Merchants Food Services came together today and picked up litter on Edward Street. This is the 3rd or 4th year in a row that they've done this, and we appreciate them leading from the front and being active in their community. Some activities you can get involved with on Make a Difference Week in Hattiesburg. Tomorrow, of course, we encourage you to find a little free library and help stock those with books. There's a blood drive on Thursday from 12 to 5 at the train depot. You can schedule your donation at redcrossblood.org/give. And then finally on Saturday, we encourage you with your family or by yourself or with a few neighbors to go out and pick up litter in your neighborhood. These are small things that we can do individually to set a good example and to make our community better. As we keep continuing the week, wash your hands, take care of yourself, wear a mask if you go out in public. Do only what is essential. Remember, you're safer at home. Have a great rest of the evening.